My fiance and I and Dr. Comer and Dr. Grimaldi, we were sitting at a group microscope. We see all these cells on a slide. He pointed out several. He said, "You see those cells?" And it's kind of, right. "You mean the big ones that look?" He said, "Those are cancer cells." He said, "You have leukemia." In a matter of 2 months, my banking career ended, and I became a full-time cancer patient.
The diagnosis changes the family dynamic from the second you say it, or it's known.
I guess because I grew up with him being sick, I got to take care of him at a young age. You know I'm your daughter, but we're also best friends. I take care of you, you take care of me.
My cancer was their cancer. They went through it with me. They were there every step of the way. And Michael is so compassionate about talking with you and kind of going through discovery with you.
You'd like to approach somebody always with some type of plan. That makes a difference, I think, for families.
A visit to the oncologist is typically a several-hour event. You do labs, you do x-rays, you do all types of tests, and then the doctor evaluates, discusses with you.
It's very alienating for patients to have to go from place to place. They don't even know whether this physician they just spoke with knows what was done an hour earlier in their care. Well, if you have a cancer center, and it's at 4003 Kresge Way, they'll know that if a family member develops this problem, I know where they can go or should go. I've worked with these people. I know what they're capable of. I know that they'll give me an amazing experience, amazing care. They'll explain what's going on, and they'll come up with a treatment plan in the first couple of days of doing this. I'm not going to multiple doctors. And if I do need to see multiple doctors, I can do it by walking downstairs or upstairs rather than across town.
Charles Osborne stayed with his wife throughout a 10-year breast cancer battle. And a way to memorialize her is to give this gift to us to be able to create the Charles and Mimi Osborne Center. We aren't spending money to have new land or new property. That we're building on what we have and making it better. You aren't going to want somebody spending their money on something that's not going to help you feel better.
I never, ever thought about not being here. That was never part of the equation.
Nobody wants to be in a cancer center. Nobody wants to have that diagnosis or have to be there. But when you do, you want them to be on top of their game. You want them to be able to provide the best care they can, and that's what the support of this facility will do.
That community of Baptists is really like a family. It was kind of like our home.
The world that I see out there through cancer eyes is much different than the world I saw as a banker. And I feel more fulfilled. I'm glad to be able to say wonderful things about my doctors, the hospital that I've spent so much time in. I spent a lot of time in Baptist, and it became home.